If you are turning 65 soon and you think you may be one of the people who can delay Medicare enrollment past age 65, because you don't want to screw it up, you want to know the fine print, I'm going to cover all that in this video. We'll go over who can delay without penalty, and then we'll discuss, okay, if I can delay, should I delay? Because that's something that a lot of people just skip right over, which is not a good idea. Third, what happens when I'm done delaying or I'm retiring, my spouse is retiring, I need to get on Medicare. How does that work? How do I prove that I could delay and don't get a penalty? What steps do I need to take to let Medicare know that I'm delaying? So first, let's cover who can delay. Basically, the line in the sand is this. If you get health insurance coverage from an employer with 20 or more employees, so that could be from your job or your spouse's job, then you can delay Medicare enrollment without penalty until that group coverage goes away, usually due to retirement. One key thing I want to point out here is it's got to be from active employment. So if you're on leave and you turn 65 at the same time, or you're on COBRA and you turn 65, that does not count. You cannot delay in those cases. So basically, a large employer, and by Medicare's definition, a large employer is 20 or more employees. I know that's kind of a small number, but that is what it is. And by the way, that is 20 employees working for the company. It doesn't have to be 20 employees enrolled on the plan. If you work for a company that's smaller than that, you need to get on Medicare at 65. You cannot delay without penalty. All right, so that's who can delay. So it's either coverage from your job or your spouse's job, and that's a larger company, you can delay. If you decide to delay, what do you do? Do you have to tell Medicare? Do you have to let them know? You do not up front. It's kind of odd that it's not that way, but maybe it makes it simpler for them. I don't know. You do it when you decide to enroll in part A and B, if you've delayed both parts, and you give documentation then. So we'll get to that in a minute. But the next thing to discuss, if I can delay Medicare enrollment, should I? For probably, I think since Medicare started, or ever since you could delay, the assumption from most people has been, I'll just stay on the group health insurance coverage until I retire or my spouse retires. And that was the right decision in many cases, for a good while. But what I'm seeing more and more is people are coming to me with their group insurance details, and we're comparing it to Medicare, and the cost for them is creeping upwards of $300 a month, sometimes more than that, to get the group coverage. And on top of that, it's got deductibles like $3,000, $5,000, out-of-pocket maximums of double that deductible. And I'm seeing a lot more cases of smaller networks. Like if you've got a plan with Kaiser Permanente through your employer, there's nothing bad about that, but you got to stick to their network, right? What if you need to or want to go broader? You want to go find a specialist, someone who's the best in your area at what they do. You want that freedom. Medicare is going to be your ticket to be able to do that. And the cost for Medicare on a monthly basis for the coverage itself is probably going to be similar, sometimes cheaper, sometimes a little more expensive just on a monthly basis for the coverage itself. But when you factor in the out-of-pocket cost exposure you have with Medicare, it can be dramatically lower. So if you use a lot of healthcare, or you have a tough year, or you're going through expensive treatments of any kind, Medicare is going to limit your total annual spend compared to a group plan. Now, there's some really great group plans out there still, but they're becoming rarer. The point is, compare your group health insurance plan to Medicare. Don't just assume staying on the group plan is the thing to do. It could be the right thing for you to do specifically, but make it an intentional decision. Do the diligence. All right. So let's say you have hung on to the group coverage for 2, 3, 4 years, whatever it is, after age 65, and you've decided to retire, or your spouse has decided to retire, the group health plan is going away. Two instances could be the case here. The first is at 65, you went ahead and enrolled in Part A, which a lot of people do because it's no cost to you, can't hurt anything. If that is the case, then you just need to enroll in Part B. If you didn't enroll in any part of Medicare, you need to enroll in Part A and Part B, obviously. The best way to get that done is online via Social Security, because that's who handles Medicare enrollment. You're going to get Part A if you haven't already, and there's a separate application for Part B only. And if you just need Part B, that's the one you're going to use. And you're going to need to enter your details in that form, but you also need to provide group evidence of group health insurance or large group health insurance. So basically tell them, hey, for these 2, 3, 4 years that I wasn't enrolled after age 65, I had group health insurance. Here's proof of it. Don't penalize me. And the traditional way to get that proof is via a form called CMS L564. And it's a very simple form. Basically, it's got some dates on it that your company's HR department should help you complete. Like, when did you, the employee, start working there? When is employment ending? When did group health coverage start with that company? When is it ending? I certify this is correct, blah, blah, blah. Here's my signature. HR contact or officer or someone at the company who can sign off on it. That's your proof. You upload that to your Part B application. And then when Social Security reviews your application, they see, you had group coverage, you're good to go. They're not going to apply a late enrollment penalty. There are some newer ways they're letting you substantiate that you had group health insurance coverage, like ID cards from your group plan, or some, you can go onto your member portal on your group plan and print some documents out that very clearly prove you had that coverage. The key is whatever proof you have needs to demonstrate I had it from age 65 until now. Not like, hey, we switched plans to at the employer from one company to another. Here's the new card and that's it. Well, there's no proof that, hey, there was something before that, which is why that L564 form is kind of the safe bet, because the HR contact is going to be able to look up the data. You had coverage with us regardless of the insurance company from this date through this date. So that is the form to get away with the delay. How do you do that, or when should you do this? If you've delayed, you need to enroll in Part B or Part A and Part B. When do you start this process? I have found that, number one, you need to be ready to get all this into gear as soon as you know the last day of group coverage. So, hey, I've decided to retire. Let's figure out what my last day of coverage is. It's usually going to be the last day of the month in which you stop working. You need Medicare to start that very next day. So the first of that following month. And so that's your target date. You need to get all those documents, the proof, the L564 form, the ID cards, whatever, get all of that ready to submit as early as 3 months before that target start date. They won't process it any earlier than that. It'd be nice if they did, but they don't. So 3 months, that when that window opens, go ahead and enroll, upload everything, get it done, because I have seen it take 2.5, sometimes 3 months, sometimes more for Social Security to get through it and process it. Just a simple little form. It's kind of crazy, but it happens. Don't delay. Don't think they're going to turn it around in a week. I've seen that happen, but I wouldn't count on it. So you enroll in Part A if you need to, Part B if you only delayed that. And then as soon as you get confirmation, hey, that's been processed, your start date is X, or even earlier than that, actually, you could do this. Go ahead and get your either Advantage plan or supplement plan, whichever way you want to go with that. I'm not going to choose a side in this video or talk about that. But set the target effective date for the same date as your Part A and Part B, if you're starting both at the same time. And the Part B date, obviously, if you just needed to get Part B. If you got any questions about that, or I need to clarify something, or something else I didn't cover, just leave a comment and I will address it. All right. Thanks. Hope that was helpful.